There was definitely a sense of alarm that these kids were coming in so sick and that there was a little bit of fear of the unknown as to what this actually was.
There's been a huge surge of high schoolers using e-cigarettes or vaping.
The FDA said today that vaping by teenagers has reached epidemic levels.
In the summer and fall of 2019, at one point we were admitting teens with vaping lung injuries several times a week. And that was like at the peak. We saw kids who had mild symptoms on one end of the spectrum and really severe symptoms on the other end of the spectrum, and then everything in between. So we saw teens who couldn't breathe on their own and they needed ventilators to help them breathe, having complications like air leaks in their lung, requiring even heart-lung bypass at the very worst. We saw many teens who initially came to us with coughing, shortness of breath with activity, vomiting, nausea, diarrhea, abdominal pain. And we saw that they had high levels of inflammation in their bodies. We saw abnormal findings of their lungs when we did CT scans and chest x-rays. Normally in medicine, we rely on what we call evidence-based medicine, based on data, based on studies. We didn't have any of that. And so because this was completely new, it was really tough to be able to face these patients, these young people and their parents, and tell them that we didn't know exactly how things were going to turn out. We found that kids were vaping a lot. They had been vaping anywhere ranging from a few months to a few years. And they were vaping all sorts of different products, not just marijuana, but nicotine, disposables, Juul, so many different kinds of products. We have years worth of research that shows that what you're inhaling from a vaping device is not safe. The substances or toxins in the aerosol that's generated can cause lung injury. And what does that look like? It can look like a condition where you may have difficulty clearing your own mucus. The lungs have a natural ability to clear mucus. They have these tiny microscopic hair cells that beat and bring up mucus, and you swallow it and you don't even know that your lungs are protecting you from the outside world. If you look at the surface area of the lungs, it is the same as half a tennis court size. It's really, really big. And naturally, it needs a way to fight off infections because of all the things in the air. I think we understand that very well now, being in a pandemic, and this is why we have to wear masks. Along with the possibility of an increased risk of infection, there's also an association with more inflammation. We have a lot of medical evidence to suggest that what you're inhaling from vapes directly is toxic to the cells of the lung and can cause inflammation, can cause even cell death in the lungs. These processes are not good for your breathing. They can lead to real symptoms. What concerns me is that, number one, that we're addicting a whole new generation of young people to nicotine. The addiction is happening at the most vulnerable time in adolescence, in the teenage years. That really sets up teenagers and young people for a lifelong issue. The second most important thing is that we don't know the long-term outcomes, the long-term repercussions of using e-cigarettes starting at an early age. And so those are the two most concerning things for me as we battle this epidemic of vaping.